To COVID-19 now, with rising case counts in the province, the question is, where do we actually stand in this pandemic? And will the boosters and vaccinations for children make the big difference? Joining me now, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Good morning to you.
Good morning, Mel.
Thank you so much for joining. Let's begin here with the latest news yesterday that select pharmacies in the province set to roll out symptomatic testing for COVID-19. There has been a little bit of pushback. We've heard from the NDP saying, let's wait, let's stop before rolling out this plan, considering it would bring in people with symptoms and those who are in the pharmacies might be compromised with their health. Can you comment on this rollout and what this could look like?
So this will be announced later in the week. We absolutely anticipate a great partnership with our pharmacy experts, and that they will be able to test in a safe manner within their facilities for those that have symptoms. We're working with them to have the best infection prevention and control protocols in place to best protect their clients, but very much welcome their partnership. They've been great partners throughout this pandemic.
Dr. Moore, are you nervous? We're heading into flu season as well. So you've got flu season, you've got testing, you've got vaccinations. There is a lot that the pharmacists are being relied upon on. Are you nervous that there might be lines blurred or the ball might be dropped in some way, shape, or form?
No, they've been great partners all along. They're immunizing against influenza, they're immunizing against COVID, and we anticipate that they'll be helpful partners in prescribing antivirals, both for influenza as well for COVID. So we're very much looking forward to their partnership.
Okay, let's talk about the booster rollout. Right now, it's for certain segments of the population here in the province. We are awaiting what it's going to look like come the new year for the general population once everyone's had it 6 months plus for their vaccinations. What has the reception been like, and are you seeing the uptake that you need?
Well, great question, Mel, and thank you so much. So first of all, only around 10% of healthcare workers who are eligible have come forward for their booster doses. So we're encouraging all healthcare workers that are eligible 6 months after their last dose to please come forward, get your third dose, boost your protection against this virus as we head into the winter months. As well, we really want our elderly, so over 70, and we have 70% of our over 70 population that have come forward to get their third dose, their booster dose. We also want our First Nations Inuit Métis partners to come forward to get their dosing. That strategy will only further protect Ontarians as we head into the cold months, as we head indoors, and protect their health. So please, if you're eligible for your third dose, please come forward, get your third dose. That will only further protect us as we head indoors.
Dr. Moore, if we don't see the numbers that you are hoping for, what is the scenario that we could be in?
Well, absolutely. We want our first doses to continue. So we're at 88 roughly percent of our eligible population that have come forward to get their first doses. We want that to increase. Then we want further protection from second and third doses as we head into the winter. We're doing relatively well. We're stable in terms of our case counts, but immunization is the way to prevent this illness, to best protect our population. So please, if you're eligible to get your third dose, first or second dose, please come forward. We're here for you. And as we're ready for the 5 to 11-year-olds across Ontario, we're really keen to best protect that population as well.
I'm glad you mentioned the 5 to 11-year-olds. Do you have an update on when this approval might be coming from Health Canada? And is the province of Ontario ready to go?
We're in daily contact with our Health Canada partners, our Public Health Agency of Canada partners. It really does seem like by the end of the month that we'll be able to roll out the 5 to 11 vaccine for those that are eligible. We're excited to be able to provide it. We've worked with all of our local public health agencies across Ontario, all 34 of them. They're ready to go. We're reviewing their plans. They're multimodal, whether it's in a school setting, whether a public health setting, a primary care setting, pediatric setting. They're ready to go. They're keen to provide the vaccine, but also to answer any questions that parents have. So very excited for the end of this month. We really anticipate that we'll be able to put needles in arms very, very soon, and keen to protect them as we head into the holidays.
Okay. Dr. Kieran Moore, appreciate you taking the time for us this morning. Thank you.